I'm Dr. Cynthia Panowicz. I'm at Rutherford Children's Care, and I've been a pediatrician for 21 years. Well, it starts when the nurse brings the child back. The nurse does the height and weight, and if it's a baby, we do measure the child's head. Then we do blood pressure and heart rate. Then once in the room, once I'm in there, the nurse gives us the growth chart, which shows how the child's been growing compared to its peers. Then we start talking about the child's development, starting at an infant, talking about if the child's rolling over, crawling, walking. Then as it progresses through toddlerhood, things it can do, drawing, riding tricycles, riding bicycles. Once it goes into school, we talk about how the child's doing in school, what grade they're in, if they're having any behavior problems, any learning problems. Other things we go over is just how the child's doing at home, how the child's sleeping, eating, how the child's doing just at home, interacting with other people. Then we also talk about safety, which is a big, important thing in pediatrics. The child getting into things that they shouldn't be, climbing, falls, bike safety, swimming, pool safety. We go over car seats, booster seats, seat belts. When the child gets to be adolescents, we talk about driving, which every parent hates to hear about. Talk about seat belts, no texting, no cell phones in the car. And that's basically, we just go over the child's life at home and life at school and see how they're doing. Well, initially we see the babies a lot. We see them the first week after birth, and we see them at 1 month, 2 months, 4 months, 6 months, 9 months, 12 months. Then we give you a little bit of a break in there. We don't see you till 15, 18 months. Then starting at 2, we just see the children yearly till they're 18. Well, any question's a good question. Just ask, if you have any concerns about your child, how they're acting at home, or if you're a first-time parent, you could compare them to your nieces or nephews or other children you see out. A lot of parents do that and ask, why isn't my child doing this at this age? And then just other questions if you're concerned about them sleeping or what they're eating or just how they're doing in school. Just anything you want to ask us is perfectly fine. Well, we tell them that the immunizations are safe, and there are certain ones that are required to get into school and to get into colleges. And of course, there's also recommended ones. And yes, the immunizations are safe. All the preservatives have been taken out of them, and a lot of these studies you see aren't backed up studies. So yes, they are safe. Otherwise, we wouldn't recommend them. Well, the doctors there are great. We have 2 other doctors, and we have 2 physician assistants, and we're all great. We love taking care of kids. We have a good time at work. The atmosphere is a pleasant atmosphere. Everybody's welcoming. Everybody's helpful.